Hi, it's Dr. Herman with a patient and her husband. This is Lynn Seagraves and her husband Wayne Seagraves. Lynn had started care here in my office for certain conditions, which I'll let her go down the whole list of what we've been dealing with. But Lynn had started here about 2.5, 3 months ago, and she had found out about my functional metabolic work and functional neurologic treatments through certain people in her community, and I'm grateful that she chose this direction, and luckily for her, she chose this direction. She had recently, I'll give a little intro if I can, and then I'll let you talk. She had recently had a heart attack at a young age, at 63 years old, and obviously that turned out to be a life-changing point for you. She told me that her motto for a long time was, if it's not broke, don't fix it. And that was until she realized that it broke. So Lynn, if I can ask you, and I can ask you both, the symptoms that you were dealing with, even before and even after the heart attack, you had from head to toe, you've been dealing with?
Well, I lost feeling in both my feet, my legs up to the knee. The backs of my hands were getting numb. My fingers would swell. My ankles would swell. My feet would swell. I would, out of nowhere, get this pain and cramping from the right side of my stomach to the left, where I would double over in tears. The only thing that would help me was if I took Rolaids. That was the only thing that was giving me any relief at all. I had a hysterectomy at the age of 30. I'm now 63. I still would get hot flashes during the day, the sweats every single night where the bed would be soaking wet. I wasn't sleeping well. I had insomnia. And then, of course, the symptoms started where it ended up where I had a serious heart attack. I had quadruple bypass surgery. I'm on a lot of medication for that. They found out I was a diabetic, high blood pressure, high cholesterol. I don't want to live on pills. I've read the side effects. They destroy the rest of your body. And so I felt to try to take another path that would help me. I dropped close to 60 pounds.
60 pounds have you been?
Since August, being on the Clearvite.
That's 3 months now.
3 months.
3 months following the Clearvite diet.
Right. I'm on the Clearvite diet. I'm also on gluten-free, dairy-free. I had the tests here. Blood tests showed I had high sensitivity to a lot of foods.
Right.
Cut them all out of my diet.
Yeah.
I no longer have hot flashes. I don't sweat at all at night. No night sweats. My fingers are normal, my ankles are normal, my feet are normal. The neuropathy is still there, but it's starting to get a little better. I don't wake up as much during the night as I used to. This treatment has truly changed my life. I'm determined that in time, once everything is balanced out and I'm on all the right diet, that I can get off a majority of these pills.
Absolutely.
And
that's it.
And not die, which is what I did. I was DOA when they brought me in, and they saved my life, so I have to thank the medical profession for that, but I don't agree with the rest of the treatment.
Well, they wanted to just give you some, for the neuropathy in the hands and feet, what did they say? It was Neurontin or?
One of those medications,
yeah.
They said there's a medication you can take for the neuropathy. I said I'm on enough for the diabetes and for the cholesterol and for the high blood pressure and the heart medication. I don't want to take any more. I have a wonderful cardiologist who my husband told about this program, and he wholeheartedly agrees with going with this type of program.
Okay.
He thinks it's wonderful. He has nothing against it. He feels it's only going to help me heal, and I don't want to go back to where I was before.
And now you feel good energy. You're not. That she's lost a lot of weight because looking at her, we did a functional immunology blood assessment along with adrenal testing and food sensitivity testing and a very comprehensive blood chemistry analysis, and also a functional neurological analysis. And we can go more into that really later or individually if I get to meet some other people out there. But you know, the swelling and the numbness and the stiffness in the hands and the feet has disappeared. And losing 60 pounds just in 3 months, to some seems like it's A, either impossible, or B, that it's not healthy, it's not safe. But what really has been going on with Lynn is that we're calming down. Let me not say we're not done, but we're calming down the whole inflammation process in her body. So the body weight is just dropping off, like it's just melting away right now, which is amazing, literally amazing. It's not, and the only exercise you're doing, from what you told me, is here in the office with the exercise with oxygen.
Basically, I was walking every day, and then once I started coming here, my husband has to get to work, so we weren't able to do it. But now that the weather's cooling off, during the hot weather, because of the heart attack, it was difficult for me to walk and be comfortable because the chest pain was getting too bad. But now we'll go back, and yeah, the diet is restrictive, and it takes time to get used to not eating the foods that put me where I was. But in the beginning of this, it was coming off quickly.
You thought you were doing the right kind of diet, right? You were on one of the most popular, right? You were doing the Slim Fast stuff, the Slim Fast shakes. I was doing
the Slim Fast shakes. I had lost weight.
Chocolate bars and shakes.
In fact, in the hospital, when the dietitian came after the heart attack to go over the diabetic diet with me, she asked me what my normal routine of food was. She quizzed me on what I ate, and when we were done, she said, "You are not the typical person to get type 2 diabetes. You don't eat fried foods, you don't eat fast foods, you're not a heavy meat eater, so for you, it's fairly unusual to wind up with diabetes. Most people eat the foods that cause it. They have a high fat content in their diet. You don't." But what I was eating wasn't healthy, and I was gaining weight, not losing weight. And now I'm losing weight, and I find that the more I eat the way I'm eating now, the healthier I feel, the better I feel. As I said, the cramps that my husband can testify how often I had them, probably every day, right?
Very often.
Very often I would double over at work when I was working and say, "Get me the Rolaids out of my purse. I can't sit up." I was in terrible pain. I haven't had that in 10 weeks already.
That's awesome.
Not any pain whatsoever.
Awesome. High five. Okay. All right, we're going to tune out now. That was a little long, but I thank you for sharing your story with people. And we'll continue to work, and maybe we'll check back in later on in another month or two or so, and